Hello, it's nearly 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Centre. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Sejong government complex with simultaneous interpretation available for you in English. Director of Health Policy Yoon Tae-oh will be briefing us on the coronavirus situation here in South Korea, filling us in on the new number of infection cases seen as of Monday midnight and what kind of efforts the government is making to contain the virus, especially with the spurt of infection cases in the capital area and the city of Daegu. Director General Yoon has taken to the podium and it looks like the briefing will begin very shortly.
8월 31일
Let us now begin our regular briefing for August 31st, Monday. As of today midnight, we have a total of 238 new local infections, and we had one additional fatality, and the death toll now stands at 324. I extend my deepest condolences to the deceased and the members of the bereaved family. In the metropolitan area, we have 183 cases, and this has been a drop below the 200 in about 2 weeks. And we believe that these is attributable to a lower number of testings during the weekend. However, we are also witnessing continued infections in the metropolitan area as well as other regions, and we have a wide spread of the local infections. And in particular, we have 79 patients with severe or critical conditions, which is about double the number that we saw the week before, and therefore the situation is very worrisome. And today also is the second day since we have implemented tougher quarantine measures in the metropolitan area, and many of our public have endured discomfort and inconveniences, and they have partake in our strengthened social distancing measures, and we thank you all for your support. We believe that these measures could also embrace a lot of difficulties to self-employed as well as many of the citizens, and therefore we need to shorten the period as much as possible, however enhance its intensity. So during this week we ask for you to stay home if you can, and also refrain from going outdoors, and also return home directly from your work. And please let us recognize this week as a week of standstill and exert our full efforts to continue toughened quarantine measures until this weekend. And the government is also carrying out pan-government efforts to intensify our quarantine measures. The Education Ministry is exerting its full efforts, and it has recommended all universities to switch to remote classes. And the Science Ministry, starting from today for the next 2 weeks, it will also provide EBS free of charge to all of the students nationwide. And the Labor Ministry also has expanded the allowances for the at-home care for the students, and it has been extended to early September. And we will also have this to be utilized, and so that we can have about 50,000 Korean won being allowed to each of these individuals for a period of a week. And also it's also recommended all of the personalized insurance, private insurance companies, employees to also work from home if possible. And we also have some updates on our quarantine measures. And as for in-hospitalization and as for the going to the life treatment centers, we would like to first clarify that all of these patients need to be classified depending on their severity of conditions and symptoms. If people are deemed to be necessary to go into hospitals, we are also limiting the time of stay at home about by a day, so that they could directly be administered to hospitals. However, However, we have some cases for light symptom patients to stay home for a days before they go to the life treatment centers. And even during these days, the public health centers will also make sure that they do not have further enhancement of the severity of their symptoms. And we will make sure that the patients could also be administered to hospitals and life treatment centers as soon as possible. As for the life treatment centers, we have secured about 1,200 new rooms, and it can house about 2,500 new rooms as of now. And we are also planning to secure more centers going forward. And as for the treatment for the intensive care units, we will also provide some support and allowances for those who need these kind of supports. And as for the fifth round of compensation for the treatment for COVID-19, and as well as the first stage of the quarantine and disinfection measures, we would like to provide some updates. And we have determined that about 203 hospitals will be subject to about 900 million Korean won of subsidies and allowances. And they include all of these life treatment centers, hospitals, and private health clinics as well. And starting from August, as we have intensified our quarantine measures, there have been some hospitals that have been subject to closure and disinfection, and we would also like to provide the reimbursement. And as of now, out of some 69, we have about 36 hospitals that will be receiving these payments, and they amount to about 400 million Korean won for this. And as for the collective action taken by the medical practitioners, they continue to exert their continued intentions to continue to go on a strike, and they have also not stated the exact reasons behind this. However, they only say that this comes as they are willing to get respect and desirable respect. However, we believe that these reasons are insufficient to provide to the public, and you need to also provide us more reasonable and rational reasonings behind your collective actions. The government is willing to exert our full efforts to engage in policy dialogues and negotiations with the medical practitioners, and we have exerted our intention to do so numerous times, and we will be also engaging in candid talks with sincerity if you sit down on the negotiating table. So we once again urge all of the medical practitioners to return to your duties. And the government will also have about 10 hospitals and emergency rooms nationwide, and we will also provide a third round of inspections as well as a third round of return to work order. And we believe that emergency rooms are also are in need of a swift response, and so we ask for the medical doctors to return to your duties as soon as possible. Moreover, as the collective actions and the walkout continues, we have many people with critical conditions that are in need of such treatment by the doctors, especially on the third level hospitals, and we will make sure that these third level hospitals will only focus on these critical patients, and we ask for the light symptom patients to refrain from visiting these hospitals and rather go to nearby smaller clinics. And please note that the public concern is heightening as we do not have medical staff who will be taking care of these people with severe symptoms. And starting from today afternoon, we will also have an in operation of our call centers for those who have received damages due to the collective action. So please utilize these call centers, which will be utilized going forward, starting from 9 a.m. to afternoon. And these call centers will also operate until we have an end to these collective actions. So it will also provide legal consultations as well. So please utilize this call center going forward. And despite such tensions and conflicts, there are still many doctors and medical practitioners who are fighting at the forefront, especially against the COVID-19 amid scorching heat. So we also would like to note the fact that many doctors, many nurses, many employees and staffs who are working at the hospitals are exerting their full efforts to treat patients. And we would like to take this opportunity to extend our deepest appreciation to all of you. And the government will make sure that we will exert our full efforts to fight COVID-19 while we stabilize the situation with the medical walkouts. And we believe that this week going forward is a very critical moment in determining whether we can flatten the curve or not in the future. And especially for the residents living in the metropolitan area, we ask you to practice a week of standstill and refrain from going outside and cancel your meetings and also minimize physical contact with others aside from your family members. Thank you very much.
지금부터 질의응답 시간을 가지겠습니다. 배석자분들은 단상위로 올라와 주시기 바랍니다.
That was a live briefing you just heard from the South Korean health authorities there with Director General of Health Policy Yoon Tae-ho filling us in on the latest on the coronavirus outbreak here in South Korea. He just told us that there were 248 additional infection cases seen as of Monday midnight, bringing the accumulated total to 19,947. There was unfortunately one extra death, meaning that the total death toll is now at 324. That wraps up our coverage of this morning's briefing. We'll be back with our regular newscast at noon Korea time. Bye for now.